Diabetes. A comprehensive overview. Diabetes is a chronic health condition characterized by elevated blood sugar levels resulting from the body's inability to produce or effectively use insulin, a hormone responsible for regulating blood glucose. This condition affects millions of people worldwide and is a significant public health concern due to its complications and economic burden. Types of diabetes. 1. Type 1 diabetes. Type 1 diabetes is an autoimmune condition where the body's immune system mistakenly attacks and destroys insulin-producing beta cells in the pancreas. This form of diabetes is often diagnosed in childhood or early adulthood and requires lifelong insulin therapy. The exact cause is not fully understood, but genetic and environmental factors, such as viral infections, are believed to play a role. 2. Type 2 diabetes. Type 2 diabetes is the most common form, accounting for approximately 90 to 95% of all diabetes cases. It occurs when the body becomes resistant to insulin or when the pancreas cannot produce enough insulin. This type is strongly associated with lifestyle factors such as obesity, sedentary behavior, and unhealthy eating habits, although genetic predisposition also plays a role. 3. Gestational diabetes. Gestational diabetes develops during pregnancy when the body cannot produce sufficient insulin to meet the increased demands. While it usually resolves after childbirth, it increases the risk of developing type 2 diabetes later in life for both the mother and child. 4. Other specific types. These include rare forms of diabetes caused by genetic mutations, pancreatic diseases, or drug-induced factors. Examples include monogenic diabetes and cystic fibrosis-related diabetes. Symptoms. The symptoms of diabetes can vary depending on the type and severity, but often include frequent urination, polyuria, excessive thirst, polydipsia, extreme hunger, polyphagia, unexplained weight loss, fatigue, blurred vision, slow-healing sores, frequent infections, such as gum or skin infections. Diagnosis. Diabetes is diagnosed through blood tests that measure glucose levels. Common diagnostic tests include 1. Fasting blood sugar test. Measures blood glucose after an overnight fast. A level of 126 milligrams per deciliter or higher indicates diabetes. 2. Oral glucose tolerance test. OGTT measures blood glucose before and 2 hours after consuming a glucose-rich drink. A reading of 200 milligrams per deciliter or higher confirms diabetes. 3. Hemoglobin A1C test. Reflects average blood sugar levels over the past 2 to 3 months. An A1C level of 6.5% or higher indicates diabetes. 4. Random blood sugar test. A random reading of 200 milligrams per deciliter or higher suggests diabetes, particularly if accompanied by symptoms. Risk factors for type 1 diabetes. Family history of diabetes, genetic predisposition, environmental triggers. For type 2 diabetes, overweight or obesity, sedentary lifestyle, family history of diabetes, ethnic background, higher risk in African, Hispanic, Native American, and Asian populations. High blood pressure or cholesterol levels, polycystic ovary syndrome. For gestational diabetes, obesity, advanced maternal age, family history of diabetes, previous gestational diabetes. Management and treatment. 1. Lifestyle modifications. Lifestyle changes are the cornerstone of diabetes management. Diet. Focus on a balanced diet rich in whole grains, lean proteins, healthy fats, and plenty of vegetables. Limit intake of refined sugars and carbohydrates. Exercise. Regular physical activity helps improve insulin sensitivity and control blood sugar levels. Aim for at least 150 minutes of moderate-intensity exercise per week. Weight management. Maintaining a healthy weight is crucial, especially for type 2 diabetes. 2. Medications. Insulin therapy. Essential for type 1 diabetes and sometimes required for type 2 and gestational diabetes. Oral medications such as metformin, sulfonylureas, and DPP for inhibitors are commonly prescribed for type 2 diabetes. GLP-1 receptor agonists and SGLT2 inhibitors. These newer medications help improve glucose control and offer cardiovascular and kidney protection. 3. Monitoring. Regular monitoring of blood sugar levels is vital. Self-monitoring devices and continuous glucose monitors, CGMs, provide real-time data to help patients adjust their treatment plans. 4. Education and support. Diabetes education programs help patients understand their condition, manage medications, and make informed lifestyle choices. Emotional and psychological support is also essential to cope with the challenges of living with diabetes. Complications. If left untreated or poorly managed, diabetes can lead to severe complications, including cardiovascular disease, increased risk of heart attack, stroke, and hypertension, kidney damage. Nephropathy can lead to kidney failure requiring dialysis or transplantation. Nerve damage. Neuropathy causes tingling, pain, or numbness, particularly in the extremities. Eye damage. Retinopathy can result in blindness if not treated. Foot problems. Poor circulation and nerve damage increase the risk of ulcers and infections, potentially leading to amputation. Skin conditions. Higher susceptibility to bacterial and fungal infections. Prevention. While type 1 diabetes cannot be prevented, the risk of developing type 2 diabetes can be significantly reduced through maintaining a healthy weight, eating a balanced diet, engaging in regular physical activity, avoiding smoking and excessive alcohol consumption, managing stress levels. For those at high risk, such as individuals with prediabetes, early interventions, including medications like metformin and lifestyle modifications, can delay or prevent progression to type 2 diabetes. Advances in research and technology. The field of diabetes research continues to evolve, offering hope for improved treatments and potential cures. Artificial pancreas systems, automated insulin delivery systems that mimic the pancreas's function. Stem cell therapy, investigating the potential to regenerate insulin-producing cells. Gene therapy, exploring ways to correct genetic defects causing diabetes. Digital health tools, smartphone apps, and wearable devices for real-time glucose monitoring and lifestyle management. Conclusion. Diabetes is a complex and multifaceted disease that requires a comprehensive approach to management and prevention. Awareness, education, and advancements in medical science are essential to reducing its global impact. With proper care and support, individuals with diabetes can lead healthy and fulfilling lives.